Management of Information chapter has standards that overlap with other standards in other chapters, such as MOI2 with QM10 and QM11, MOI3 with LD19, MOI6 with PFR7 and MR13, and MOI11 with QM10.3. We live in an era of abundance in terms of data and information content and technology. It is vital that hospitals utilize these valuable resources to improve their services towards safe patient care. MOI1 Information Needs Assessment Process. The information technology market is a very competitive one, with new and advanced capabilities that inundate hospital leaders. Making the decision to automate or to replace an existing system should undergo thorough analysis to ensure it meets stakeholders' needs towards smooth and safe services and work processes. Investment in information technology is a costly process. It consumes time, expertise, and funds. Hence, it should be given adequate time to ensure thorough assessment is conducted. To evaluate MOI1, we review meeting minutes or reports containing stakeholders' input on their information needs. Information needs may be in the form of programming, linking existing softwares, improving access to certain data and information, provision of knowledge-based resources, or training on data mining and analysis. The hospital should consider contribution to regulatory bodies such as the Ministry of Health and Human Resources links to Saudi Commission for Healthcare Specialties and the Labor Office. MOI9 Downtime Management. Hospitals' operations depend on partial or full automation of their work processes. This makes them vulnerable to hardware or software downtime. To ensure completeness of data during downtime, a process must be in place to capture required information manually. This process must be monitored to ascertain data and system integrity. MOI9 requires the availability of a process that details the management of scheduled and unscheduled downtime. Forms should meet the data elements to be entered in the electronic system. Frontline staff interviews should reflect their awareness on when and how to shift to manual data entry and what to do when the system is running. During the IT department visit, we review the downtime assessment report and how data integrity is verified. MOI10 Data Backup Process. As part of the hospital responsibility to safekeep patient care data, a backup system must be in place. Data backup is done at different frequencies and intervals. Hospitals must ensure integrity of their data and the process for retrieval. MOI10 compliance is confirmed through review of the backup process and staff interview during unit visit to the IT department. MOI12 Information Support for Safe Patient Care. The hospital information management process should include provision of resources to enable staff and leaders to access evidence-based information in a timely manner. Knowledge-based resources such as physical or electronic medical library is vital in ensuring access to current best practices and clarification of ambiguities during care delivery. For MOI12, we interview different staff to verify how to manage clinical inquiries and what types of knowledge-based resources they have at hand. Staff interview should also reflect how these resources are utilized to improve patient and staff education, updates in clinical guidelines, and policy development and revision.